Good evening and welcome to Metro Focus. I'm Jenna Flanagan. The statistics are nothing short of startling. Between 2013 and 2016, there was a 90% increase in opioid deaths across America, and the crisis is hitting close to home. Here in the state of New York, we have the nation's largest patient population in opioid treatment programs, and Governor Cuomo recently announced the distribution of more than $25 million in federal funding, with the aim of expanding addiction prevention, treatment, and recovery services across the state. The responsibility of overseeing these efforts to tackle addiction falls on the shoulders of Arlene Gonzalez Sanchez, the Commissioner of the New York State Office of Alcoholism and Substance Abuse Services, and I'm pleased to welcome her to the program now. Thank you for joining us.
Thank you for inviting me.
So first, tell us a little bit about what is it that this $25 million federal funding is going to be going to?
Well, the $25 million will be used to focus on addressing the opioid crisis that we have here in the state. It's really going to go to any prevention, treatment, and recovery services that exist. And it's also going to develop innovative services that we need to really address this epidemic. The idea is to really target, underserved areas so that we could expand treatment services and also, lower, if not do away with, the overdose deaths that are associated in those areas.
Now, when you talk about prevention and treatment services, we do know that there are some prevention, first of all, there's been a lot of prevention services in schools and other locations, and then of course treatment services. So is this about beefing up what we already have, or is it about expanding it in a new and a different way?
It's both. There are some schools that really need additional prevention services, so we're looking at creating programs in the schools. We're looking at teaching kids very, early on, about drugs, addiction, and so on and so forth. But it's also doing new things, environmental things in the environment, in the community, doing more preventive work that young folks really understand, rather than being in a classroom where a teacher is telling you, don't do this, don't do that. So it's a combination where we're not just going to do the same traditional pieces that we've done, but also do more, outreach, do more having youths talk to other youth in the community to talk about prevention.
Now, you also mentioned about areas of the state that might not have the same access. Of course, we air here in the New York City area, but New York is a whole state, and what works in New York City might not work in some of the more rural parts of the state. So just explain to me a little bit of that difference.
Exactly, and that's what we were up against a couple of years ago with the challenge of the opioid crisis. There are areas that are very rural in New York State where there are very little, if any, services, any treatment services. So we have taken a very aggressive approach in establishing treatment services. We know we can't establish clinics in every part of the region, so we've done things like mobile treatment, where there's a van that's like a hospital on wheels, so to speak, a clinic on wheels. So we go to areas that are very remote, that people can travel, but yet the addiction has hit those areas. So we travel to them and we assess people, we treat people. We're also expanding telepractice, which means you could have a therapist in New York City seeing someone in a TV monitor up in the St. Lawrence area.
Wow.
We're doing that. We're also expanding our medication-assisted treatment slots throughout the state, and this is all being done mobile for now. Eventually, what we would like to do is establish, clinics in some of these remote areas, but in the interim, we really had to do something quick to avoid all the overdose deaths, because the reality is, you have some areas, Oswego, and if you look at where could they go for treatment, it would be Buffalo. It's like a 2.5-hour ride, 3-hour ride. How realistic?
And that's if you have access to a car.
If you have access to a car. So how realistic is it for someone who even wants to get better to do that. So that's why we decided, let's do the mobile treatment piece, and then we work on establishing, all these other more long-term, clinics and so on and so forth.
Well, comparing the mobile treatment piece to a long-term clinic, one of the things that I've heard that can be incredibly challenging for people who work with people who are in the grips of addiction is that when an addict reaches a place where they say, okay, I am ready, I would like to get treatment, I need to change my life, and they want to go into long-term treatment, but then it's a matter of figuring out where there's a bed. So is that something that's also going to be folded into this, is helping people figure out where the beds even are?
Absolutely. As a matter of fact, it's that we have already established. We have a dashboard on our website where anyone could go 24/7 and find where there's a bed and the type of bed and for the type of individual. At real life time, you don't have to pick up the phone and talk to anyone. You go on the website and it tells you there's a bed for a female, a pregnant female, a youth, a female, a male. So that's already in the works.
And again, these 24/7s, how prevalent would they be, especially when we're talking about, like you said, rural parts of the state?
Yeah, well, that's the intention. We have at least one in every of the 11 regions of the state, and we're looking to open more centers as we move forward.
Okay. So you mentioned also the issue of police being a part of this because, of course, a lot of addicts come into contact with police constantly. Will there be any particular training, I guess, that's given to, or special training that's given to law enforcement to not only make sure that they know that locking up addicts isn't necessarily going to be the best way to help them, but that the state is actually now putting funding behind these alternative methods?
It's a matter of fact, we have one of these centers in Staten Island, we have one in the Bronx, and they're very closely related in collaboration with the DA's office. And they're working hand in hand. As a matter of fact, they're being very productive, I want to say, because we have the law enforcement working with us and our community-based organizations to use it as a diversion into the criminal justice system. Now, I'm not saying that if you commit a violent crime, you're not going to be charged. This is going to be for low-level crimes, possession, and so on and so forth. But it's working out really well, especially in Staten Island. We have seen a large number of diversion and people going into treatment rather than doing jail time. And even after finishing treatment, really getting their lives together and living in the community a fruitful life. So it's showing so far it's proven to be a good model.
Well, definitely having that level of trust, I think, is one of the most crucial steps. Listen, I want to thank you so much for joining us on the program and letting us know about all of these innovative and crucial new steps that the state is taking in the fight against opioid addiction.
Thank you. It's a pleasure to be here, and thank you for having us and helping us spread the word.
Absolutely. Thank you.